On this episode, we are speaking about meningitis in children. Although Trinidad and Tobago generally has a low occurrence of meningitis, it can lead to devastating complications which can be prevented if diagnosed early. Any delay in diagnosis and treatment can result in serious long-term problems such as hearing or vision loss, which may be partial or total, as well as seizures and problems with memory and concentration. Today, we are pleased to welcome to the program Dr. David Bratt, a practicing pediatrician for close to 50 years.
Today's Vitaminute features folate. Folate is a natural form of vitamin B9, water-soluble and naturally found in many foods. It plays a key role in breaking down homocysteine, an amino acid that can exert harmful effects in the body if it is present in high amounts. Folate is also needed to produce healthy red blood cells and is critical during periods of rapid growth, such as during pregnancy and fetal development. Good sources of folate include dark green leafy vegetables such as turnip greens, spinach, romaine lettuce, asparagus, Brussels sprouts, and broccoli, beans, peanuts, sunflower seeds, fresh fruits, fruit juices, whole grains, liver, seafood, eggs, and fortified foods and supplements. And that was today's Vitaminute.
So tell us, Dr. Bratt, what exactly is meningitis?
So meningitis is a very serious illness of basically of children, although adults can get it. And it's an inflammation of the meninges, which is like a very fine, thin plastic. It actually has 3 layers, but we'll forget about that, which surrounds the brain and encompasses the brain and sort of keeps it in its physical shape, as well as offering assistance to it, to the arteries and so on. And it has a predilection to get infected by germs.
How will germs even get into the brain through the skull? How is that possible?
Through the blood, because of course the blood part in your body goes everywhere.
Right.
So if you have, for example, let's say a common scenario is you have a bad cold, and the tubes that drain the middle air. The middle air is part of your nose. A lot of people don't understand this. So it secretes fluid. And if the cold blocks up the middle air, the drainage of the middle air, the fluid accumulates there. Anytime fluid stagnates anywhere, it tends to get infected.
Correct.
Same thing with the middle air. It gets infected with bacteria, and those bacteria then travel in the bloodstream. Usually, sometimes it can, through a local process, get into the brain too, and it infects this membrane that surrounds the brain, which sort of protects the brain too. Okay. And it causes serious illness. If you have meningitis, you're very sick, that's hospital.
But not everybody gets meningitis after a cold, so who's predisposed to getting something like that?
In children, we're really not too sure what the reasons are. We always talk about whether they have an immune deficiency of some sort against that particular germ, or is there some defect in the meninges itself, or is there something wrong with the bone structure surrounding the brain which allows bacteria to get? Most of the time we don't know. We really don't know. And most children who have meningitis and recover from meningitis don't get meningitis a second time, unless, again, like I said, there's some defect of the central nervous system which predisposes them. The back, the vertebrae and the back don't close off properly, and that leaves a hole, and that's a totally different thing. But normal, healthy children, if they're not immunized, can get meningitis.
Right. So it would be really the kids who have kind of fallen off on their vaccination schedule.
Right now, those are the kids who will get meningitis.
Right.
And they are very few, fortunately. In Trinidad and Tobago, we have a very good, very solid immunization program as far as meningitis is concerned.
Right.
So that I don't think they're seeing very many cases of meningitis in our hospitals, because of course these cases don't end up in private nursing homes. Private nursing homes can't take care of children who are seriously ill. You have to go to the, people need to know this, you have to go to the public hospital, whether it's Mount Hope or San Fernando or Sangre Grande.
So let's talk first of signs and the symptoms of meningitis. What would that look like? First off, let's say a baby.
So sick, so that they're going to develop fever.
Right.
And they're going to develop, this is serious fever. This is not your little, I think the child feeling warm.
Not responding to Panadol at all.
Not responding to Panadol. The child is lethargic, the child is not drinking, the child is not eating, the child probably is going to be vomiting, the child is going to look very, child may be breathing heavily, real sick child.
Yeah.
In the beginning then, it's sort of difficult because it may start or just as a child who is not too well, the baby is
irritable.
not eating as that much, a little peevish.
Yes.
And then it gets irritable for me, is more serious than peevish. And then the next thing, you know, you have a child who may even be convulsing. And then that's
having a seizure.
Having a seizure, yes.
Stiffening up and then relaxing.
Jerking,
right.
Unconscious, and that sort of thing. If once it gets to that, that baby is serious. So you really have to stop it before.
So the mums out there were looking on.
Yeah.
What would be, we want to pick it up early if it's happening.
Yeah.
What would be that telltale sign for the mums to know, all right, hospital, this is serious?
Yeah. Baby not eating. Baby not eating, but baby, that's what babies do.
Correct.
They eat, they sleep, and so on and so forth, they smile. Baby stops smiling, important sign, baby not eating, baby lying down there too quietly.
Yes.
And that's a serious thing because I've seen babies brought into a hospital and the parents say the baby's sleeping, but the baby's sleeping too much. No, something's wrong. Those are the signs.
Good.
It's difficult. It's difficult for a mother, especially a young mother. So the thing is, if you're not sure, go. Take the baby, have somebody tell you, no, this baby it's not serious. It doesn't have meningitis, it doesn't have pneumonia, it's not dehydrated. But because in the beginning, children, in the first 24 hours, children may be sick. They may be going to get very sick. But they don't look very sick. They're not behaving that bad. They're a little bit quiet and so on. And then it starts to progress. And a word of caution, the disease that progresses at night, and you're scared at night, and you think something is wrong with your baby, take the baby to the hospital.
That's right.
Take the baby to the hospital.
Too many times you see parents, they go, well, we'll wait until the morning.
No, don't wait until the morning. You're concerned, the baby's not looking well, the baby's vomiting and not drinking, you can't get the fever down, take the baby to the hospital.
Because things happen very quickly with kids.
Very quickly. Yeah, very quickly. They get sick very quickly and they get better very quickly.
Yeah.
So
once they're refusing food and water, that's a problem.
Yes.
Not
Fever,
responding, not smiling.
Not smiling, yeah, those are all important signs.
So don't hesitate to pick up the phone to call.
Yes.
Just go straight to casualty. It will have to be a public hospital, not your GP.
If you go to your GP or you go to one of the private nursing homes, they're going to send you to the public hospital.
And time is of the essence.
Child, they're going to send you there right away.
And what should they expect when they get to casualty? They're going to have to go through a lot of tests. They're going to see their baby going through some...
Yes.
Poking.
Well, the first thing that is that the baby should be attended to as rapidly as possible.
Yeah.
So you have to tell whoever sees the baby the first time, my baby is really sick. I don't like the way my baby is looking. I need you all to see the baby right away.
Yeah.
And then they're going to take the baby away from you. If the baby is really sick, they have to take the baby away from you. You may not be able to see the baby for a while they take blood, put up a drip, and in the case of meningitis, they're going to do a lumbar puncture, which means putting a needle into the back of the baby to obtain some of the fluid from the brain.
That bathes the meninges.
That bathes the meninges to see if there's infection in it.
Yeah.
And once there's infection in it, once they see that, and sometimes when you do this, the fluid comes out and you can see it's pussy fluid.
Yeah.
And once you see that, your drip is up, you give the first dose of antibiotics. And that first of antibiotics is crucial because that is what really starts killing the bacteria and prevents the infection from progressing into the substance of the brain itself.
Correct.
And then damaging the substance of the brain. And now you end up with a child with damage to the brain who has a big head, or who is paralyzed, or who can't hear, or who can't see. And then those are some of the serious complications of a child with meningitis.
So it's important, I think, that the parents are aware that the tests that have to be done
yes.
are absolutely essential.
Yes, yes.
They are a bit, they are invasive.
Yes.
You know, as you said, the lumbar puncture,
yes.
it's not, I mean, yes, we do allow parents to see, but
yes.
it's not for the faint of heart, but it's so absolutely necessary
yes.
because not only are we going to diagnose, we're going to actually be able to know which bug is in there and what antibiotic is sensitive to that bug.
Yes.
So we know exactly what to use.
In the beginning, you give the most common, you assume it's the most common bug, and you give the most common antibiotic, which covers a lot of bacteria, because it's, what we're concerned about really is bacterial meningitis. You can also have viral meningitis, but that is much more common, but much less dangerous. You know? So that's that. You need to do that lumbar puncture.
Do all the kids have to do a CT scan?
Not necessarily.
Okay.
Not necessarily. It would depend on how sick the child came in. It would depend on how sick the child looks after 24 hours, whether you decide to do something more extensive.
Right.
Yeah.
So the child will normally be in the hospital, if diagnosed, and would be in the hospital.
10 to 14 days.
Yeah, on IV
10
drips,
days IV drips.
as well as antibiotics.
Yes.
Worst case scenario, there are complications that may occur if the child is not brought in a timely fashion, and so the treatment is delayed.
Yes.
Or child, let's just talk about that scenario first off. Delayed treatment, you will have complications.
Yes.
What are the complications of meningitis?
Well, the most common one is hearing loss.
Yeah.
That's almost, if it's delayed and serious, that almost certainly is going to happen. So after the treatment, you're going to have this child's hearing evaluated, because it's it affects the nerves of the hearing nerve. That's a common one. Another one may be that the child may have some degree of paralysis of a limb, so be unable to move a hand or be unable to walk well. So that's a serious one. And actually, anything that you can think of that the brain does well, it can affect the brain. So things may not turn up for years until the child starts going to school, and then you realize the child has a problem in learning, a little slower, a little more clumsy, coordination, things like that. A little not as be emotionally stable, a little unstable emotionally. All of those things are things that are possibility.
Really? Okay.
Yes, depending on what part of the brain ends up being affected by the infection due to delayed diagnosis and delayed treatment.
So should all kids who've been diagnosed, treated for meningitis, all of them get auditory testing?
They should.
Testing for their hearing?
And they should get followed up for years
for their milestones.
Until they're in school, and you're doing good in school, and then you can really relax.
Up to what age? Like, we're talking about high school?
Yes, until they're 11.
Yeah.
Till 11. Yeah.
Okay.
Yeah. Yes. And even so, after that age, there may be some problems. We don't see much meningitis anymore, because we have a good immunization program, which started as far as meningitis is concerned, it started in the 90s.
Yeah.
And it has continued well. It's routine. All of the children receive. So we are talking about causes of meningitis. So basically, it's either viral or bacterial.
And what type of
bacteria? The viral are not too important.
Okay.
The viral, it's very common. Mumps gives you, and measles and stuff like that.
And we already have that on the schedule.
We have that on the schedule. So it's 3 bacteria that cause bacterial meningitis. One is Haemophilus influenza, type B, which is a nasty little character that causes a lot of illness. It causes ear infections. It used to cause something called epiglottitis, which used to cause children to suffocate to death. Yeah. It causes pneumonia, and it also causes meningitis. And of course, it's called a type B. So it's called H. Haemophilus, I. Influenza B. It's called, the vaccine is called HIP. The HIP vaccine is routine in Trinidad and Tobago. All babies
Everybody
get it.
Gets it.
2 months, 4 months, 6 months, 18 months, 5 years.
Right.
It's routine. You're supposed to be not allowed to go into school unless you have at least 3. But that's another story about children who go into school and they aren't immunized. So that's the first one. The second bacteria that causes meningitis is the pneumococcus.
Yes.
the pneumococcus, which causes pneumonia especially, but it also causes pneumococcal meningitis. Maybe about 10% of the cases we used to see was pneumococcal. So there's a vaccine for that, and that's either the Synflorix. Is it Synflorix? I forget. The one we're using now in Trinidad is the Prevnar 13, which we've been using for years.
And that's every kid in the health centers.
In the health centers.
We're offering it.
You get it free.
Okay.
You can just go in and get it, and the nurses will gladly get it. They're happy to give it to you too. The third bacteria that causes is meningococcal, the bacteria called meningococcal, which fortunately we don't have in Trinidad as much as other countries do, so we don't give it routinely. A lot of students, however, who want to go away to study, and especially if they're going to be sleeping in the dorms, yes, they have to take them. They have to get the meningococcal vaccine.
Let's talk a little bit about that. So, okay, my kids, they're getting ready to go to university. I'm not even sure if they would have been vaccinated for that. What do I do?
It's available in the health centers.
Yeah.
It's available privately. So all you need, if most of the university forms, the college forms.
Right.
I'm not sure about UWI. I don't think UWI UWI doesn't request it, no. But if you're going away, there is a form to fill out, and one of the things they will ask you, if your child is going into the dorm, then you have to give us, you have to tell us you don't want it, otherwise he won't be allowed in the dorm.
Yeah.
Because otherwise we want the child to have it. And that is usually given when they're about 15, 16, 17, 18 years old.
Yeah. From your experience, the significance and the importance of vaccinating our babies before they get into school. Talk to us a little bit about that, especially when it comes to something that's so preventable like meningitis.
Yes. We have a good program, and we have been able to control. When I started at Port of Spain Hospital in 1977 with Dr. Webb and Dr. Cameron, and Dr. Ramkisoon was there, and Dr. Dial was there. Wow. All the old stages were there. We would have meningitis cases and cases of epiglottitis on Ward 43 and 44. And in South, Dr. Isahak Mohammed, Reggie Cox, who were the two pediatricians that, talking about the original pediatricians, those four people, Dr. Ramkisoon, Dr. McDowell up north, Dr. Mohammed and Dr. Cox in South, they saw meningitis all the time. They always had 1 or 2 cases of meningitis on the ward. Yeah. And we lived through the introduction of the vaccine in Trinidad in the 90s. So I'm talking about, we would have experienced almost 20 years of seeing children with meningitis and their complications on the ward. Vaccine introduced, and in 10 years' time, we're not seeing meningitis anymore. Brilliant.
And we need to continue. We need to continue that
because the bacteria is still out there. People don't understand this. The bacteria doesn't disappear. It's there. Yeah. It's just waiting to find somebody who is not defended by the vaccine. And this vaccine is, by the way, this vaccine is safe. This vaccine is not like COVID where you have all kind of people think this and that and the other.
It was well tested.
It's well tested in thousands of children over a series of years before it was allowed into the community, and it has shown itself to be so effective and safe over so many years. So it's something I think most people accept and do without even knowing what it is their child is getting, just to know the child is being protected.
So stick with the schedule.
Yes.
Again, look at if your child has a fever, observe it.
Yes.
If the fever's not coming down with Panadol and with cooling your baby.
And you find the child is getting worse, more lethargic, more quiet, less eating. Yes.
Alarm bells, red flags.
Yes.
Pick up, doesn't matter what time, go to the hospital.
That's right.
A hospital, public hospital, be preferable, casualty, alert the nurse in attendance.
Yes.
My baby is really not looking well. This is not my normal baby.
Yes, exactly. Those are important words.
Yes.
This is not my normal baby. The nurse may, all mothers coming and think their little baby is very sick, but somebody needs to look at that baby, immediately triage the baby and say, look, this baby is looking a little too sick for me, into doctor.
If you had to leave the audience with one golden nugget on meningitis and probably even vaccination as a whole, what would you say? Yeah,
that vaccination program in Trinidad and Tobago is one of the best public health things that we are doing. Lots of things in public health we're not doing, but vaccination, the public health nurses, the ladies in brown, I think I remember Dr. Lennox Jordan used to call them that. The ladies in brown know what they're doing and they're good at what they're doing, and we really should salute them. Yes.
Thank you. Thank you, Dr. Bratt.
Yeah, you're welcome.